Every senior forgets things from time to time. You walk into a room and cannot remember why you went there. You misplaced your keys for the 10th time this week. You cannot recall the name of that actor in the movie you just watched. These little memory slips are completely normal and happen to everyone as they age. But neurologists are now warning that there are 5 specific types of memory problems that are not normal aging. And if you or someone you love is experiencing them, it could be an early sign of something far more serious. Please do not ignore this video, because the difference between catching cognitive decline early and missing it could be the difference between getting treatment that slows it down and losing years of precious memory and independence. Let me start by telling you about something that happens far too often. A person in their late 60s or early 70s starts noticing changes in their memory. Maybe they forget appointments they made just yesterday. Maybe they get confused in familiar places. Maybe they ask the same question over and over without realizing they already asked it. Their spouse or children notice the changes and feel concerned, but the person brushes it off. They say things like, "Everyone forgets things at my age," or "I am just getting older. What do you expect?" And because the changes are gradual, because they happen slowly over months and years, everyone eventually accepts them as normal. But here is what neurologists want you to understand. While some memory decline is a normal part of aging, there is a clear line between normal age-related forgetfulness and the kind of memory problems that signal actual cognitive decline. And knowing where that line is could give you or your loved one the best possible chance of getting help early when treatments are most effective. I am Dr. Charles Anderson, and today I am going to share with you the 5 memory warning signs that neurologists say are not normal aging. I am going to explain exactly what makes each one different from ordinary forgetfulness, what it could indicate about your brain health, and what you should do if you recognize any of these signs in yourself or someone you care about. I will also share some practical strategies that neurologists recommend for keeping your brain sharp and some exciting developments in the field of cognitive health that are giving researchers real hope. So please stay with me all the way through, because this is one of the most important topics I have ever covered. Before we get into the 5 warning signs, let me quickly explain what happens to the brain during normal aging, so you have a baseline for comparison. As we get older, our brains naturally undergo some changes. The brain actually shrinks slightly in volume, particularly in the frontal lobe and hippocampus, which are areas involved in higher cognitive function and memory. The connections between neurons can weaken, and the brain's processing speed slows down. These changes are why it might take you a little longer to recall a name or why you might find it harder to multitask than you used to. But here's the crucial point. Normal age-related memory changes do not significantly interfere with your daily life. You might occasionally forget a name, but you remember it later. You might misplace your keys, but you retrace your steps and find them. You might have a word on the tip of your tongue, but it comes to you eventually. These types of memory lapses are annoying, but they do not prevent you from living independently, managing your finances, driving safely, or maintaining your relationships. When memory problems start crossing that line, when they begin to interfere with daily activities and functioning, that is when neurologists get concerned. Now let us go through the 5 warning signs, one by one. The first warning sign is forgetting recently learned information and not being able to recall it later. This is one of the earliest and most common signs of cognitive decline beyond normal aging. Everyone forgets things occasionally, but with normal aging, the forgotten information usually comes back to you eventually, either on its own or with a reminder. The red flag is when you learn something new, a date, a name, a piece of information, and it simply does not stick. No matter how hard you try to recall it, it is gone. A classic example is making plans with someone on Tuesday to meet for lunch on Friday, and then on Friday having absolutely no recollection of the conversation. When your spouse or friend reminds you, it does not ring a bell at all. It is as if the conversation never happened. This is different from normal forgetfulness, where a reminder would trigger the memory. When the brain is unable to encode new information or retrieve it even with cues, it suggests that the hippocampus, the brain's memory center, may be affected. If this is happening regularly, it is a sign that you should talk to a neurologist. The second warning sign is difficulty with problem solving or planning that you used to handle easily. This one is often overlooked because people do not always associate it with memory. But the ability to plan, organize, and solve problems is a cognitive function that relies heavily on memory and executive function. If you are noticing that tasks you used to do without thinking are becoming confusing or overwhelming, that is a warning sign. For example, if you have always paid your own bills and managed your finances, but now you are finding it hard to follow a budget or keep track of payments, that is concerning. If you used to follow recipes easily but now find yourself getting confused by the steps, even for dishes you have made many times before, that is a red flag. If you are having trouble following a familiar route while driving, or if you are struggling with games and puzzles that you used to enjoy, these are signs that your cognitive abilities may be declining beyond what is normal for your age. Neurologists often look for a pattern of declining performance in these kinds of everyday tasks when evaluating someone for cognitive impairment. And the third sign might surprise you, because it is not about forgetting facts or names at all. It is about confusion with time and place. If you find yourself losing track of dates, seasons, or the passage of time, or if you sometimes do not know where you are or how you got there, this is a significant warning sign. People with normal aging might momentarily forget what day of the week it is, but they figure it out quickly. The concern arises when someone consistently does not know what month or season it is, or when they find themselves in a familiar place but feel disoriented or confused about their surroundings. This type of confusion goes beyond simple absent-mindedness. It suggests that the brain's ability to orient itself in time and space is being affected, which can be an early sign of Alzheimer's disease or other forms of dementia. The fourth warning sign is withdrawal from social activities or hobbies. This is one that family members often notice before the person themselves. If someone who was previously socially active starts pulling away from friends, family gatherings, church groups, or hobbies they used to enjoy, it could be a sign that they are struggling cognitively and trying to hide it. Many people with early cognitive decline become aware that something is not right, even if they cannot put their finger on exactly what it is. They may feel embarrassed about forgetting conversations or confused by activities they used to enjoy, so they withdraw to avoid those uncomfortable situations. They might stop reading because they cannot follow the plot of a book. They might stop playing cards because they cannot keep track of the game. They might avoid phone calls because they have trouble following conversations. If you notice these changes in someone you love, approach them with compassion and understanding, not with judgment or alarm. But do encourage them to see a doctor because early intervention can make a tremendous difference. The fifth warning sign is changes in mood and personality that do not have another obvious explanation. The brain is not just responsible for memory and thinking. It also regulates our emotions, our personality, and our behavior. When the brain is affected by cognitive decline, these areas can be impacted as well. You might notice that someone who was previously calm and easygoing has become irritable, anxious, suspicious, or easily upset. They might become confused and fearful in situations that would not have bothered them before. They might accuse family members of stealing things that they have simply misplaced. They might become unusually passive or withdrawn when they were previously outgoing and engaged. These personality changes can be heartbreaking for family members to witness, and they are often misattributed to stress, depression, or just being difficult. But when these changes occur alongside memory problems, they can be a sign that cognitive decline is affecting the emotional centers of the brain, and they should be taken seriously. Now, I want to be very clear about something. Experiencing one or even two of these warning signs on occasion does not necessarily mean that you or your loved one has dementia. There are many other conditions that can cause memory problems and cognitive changes in seniors, and many of them are treatable and even reversible. Depression, for instance, can cause significant memory problems, difficulty concentrating, and withdrawal from activities. Thyroid disorders, vitamin deficiencies, particularly vitamin B12 deficiency, medication side effects, sleep disorders, and even urinary tract infections in older adults can all cause cognitive symptoms that mimic dementia. That is why getting a thorough medical evaluation is so important. A neurologist can run tests to rule out these reversible causes and determine whether the symptoms are due to normal aging, mild cognitive impairment, or a form of dementia. And even if the diagnosis is dementia, early detection means earlier access to treatments that can slow the progression and help maintain quality of life for as long as possible. But here is where I want to give you some real hope. The field of brain health and cognitive decline has advanced enormously in recent years. Researchers now understand much more about the factors that contribute to cognitive decline, and many of them are things you can actively address. Let me share with you the strategies that neurologists recommend for keeping your brain as healthy as possible. The first strategy is physical exercise. Study after study has shown that regular physical activity is one of the most powerful things you can do to protect your brain. Exercise increases blood flow to the brain, promotes the growth of new brain cells in the hippocampus, reduces inflammation, and lowers the risk of the vascular problems that can contribute to cognitive decline. You do not need to run marathons. Walking for 30 minutes most days of the week has been shown to significantly reduce the risk of dementia. Swimming, cycling, dancing, and even gardening all count. The key is consistency. Find an activity you enjoy and do it regularly. The second strategy is social engagement. Your brain thrives on connection. Social interaction stimulates multiple cognitive systems at once. You have to listen, process information, formulate responses, read emotions, and engage your memory. Numerous studies have shown that seniors who maintain active social lives have lower rates of cognitive decline. This can mean spending time with friends and family, joining a club or group, volunteering, taking classes, or even regular phone calls with people you care about. If the pandemic or health issues have left you more isolated than you would like, make reconnecting a priority. Your brain will thank you. The third strategy is cognitive stimulation. Just as physical exercise keeps your body strong, mental exercise keeps your brain sharp. This means challenging your brain with new and varied activities. Learning a new language, even if you only learn a few phrases a week, has been shown to strengthen cognitive function. Playing musical instruments, doing puzzles and crosswords, reading challenging material, playing strategy games, and learning new skills all help build cognitive reserve. Cognitive reserve is the brain's ability to cope with damage. The more reserve you build through a lifetime of mental stimulation, the better your brain can compensate for age-related changes. The fourth strategy is nutrition. What you eat directly affects your brain health. The Mediterranean diet, which emphasizes fruits, vegetables, whole grains, fish, nuts, and olive oil while limiting red meat and processed foods, has been extensively studied and consistently shown to reduce the risk of cognitive decline. Specific nutrients that are particularly important for brain health include omega-3 fatty acids, found in fatty fish like salmon and sardines, antioxidants, found in berries and leafy greens, and B vitamins, found in whole grains, legumes, and animal products. Some researchers also recommend limiting added sugar and refined carbohydrates, which can contribute to inflammation and insulin resistance, both of which are linked to cognitive decline. The fifth strategy is quality sleep. As we discussed in an earlier video, sleep is when your brain clears out toxic waste products, consolidates memories, and repairs itself. Chronic poor sleep is a significant risk factor for cognitive decline. If you are not sleeping well, prioritize getting help for whatever is disrupting your sleep, whether that is sleep apnea, pain, anxiety, medications, or poor sleep habits. Your brain needs 7 to 8 hours of quality sleep every night to function at its best. The sixth strategy is managing your cardiovascular risk factors. What is good for your heart is good for your brain. High blood pressure, high cholesterol, diabetes, smoking, and obesity all increase the risk of cognitive decline and dementia. By managing these conditions aggressively, you are not just protecting your heart, you are protecting your brain. Work with your doctor to keep your blood pressure, cholesterol, and blood sugar in healthy ranges. And if you smoke, quit. The benefits of quitting extend to every organ in your body, including your brain. The seventh strategy, and this is one that neurologists are increasingly excited about, is maintaining a sense of purpose. Research has shown that people who have a strong sense of purpose in life, whether that comes from family, faith, community involvement, creative pursuits, or meaningful work, have lower rates of cognitive decline and dementia. Having a reason to get up in the morning, something that makes you feel useful and connected, is not just emotionally satisfying. It is neurologically protective. If you have lost your sense of purpose, whether through retirement, loss of a spouse, or other life changes, finding new sources of meaning and connection is one of the best things you can do for your brain. Now, let me address something that I know is on many of your minds. What should you do if you recognize some of these warning signs in yourself or someone you love? The first step is to see your primary care doctor and express your concerns. Do not minimize what you are experiencing. Be specific about the changes you have noticed and when they started. Your doctor may refer you to a neurologist for further evaluation, which typically includes cognitive testing, blood work to rule out reversible causes, and possibly brain imaging. Remember that an early diagnosis is not a death sentence. It is an opportunity to start treatments that can slow progression, to make plans while you are still able to access support services, and to take steps to maintain your quality of life for as long as possible. If you are a family member who is worried about a loved one, have the conversation gently and lovingly. Approach it from a place of caring, not criticism. You might say something like, "I have noticed some changes and I am a little worried. I would feel so much better if we could just check in with your doctor together." Many people are resistant to acknowledging cognitive changes, and that is understandable. It is frightening, but your concern and support can make all the difference in getting someone the help they need. I want to close by reminding you that your brain is remarkably resilient. Even in the face of aging and cognitive challenges, the brain has an incredible ability to adapt, compensate, and form new connections. Scientists call this neuroplasticity, and it does not stop just because you have reached your 60s, 70s, or even 80s. Researchers have found evidence of new brain cell growth even in people well into their later years, and the connections between neurons can continue to strengthen with the right kind of stimulation. That is profoundly encouraging, and it means that the choices you make today genuinely matter for your cognitive future. I also want to mention something about the emotional toll that memory concerns can take, both on the person experiencing them and on their loved ones. It is completely natural to feel scared, frustrated, or even angry when you notice changes in your memory or thinking. These emotions are valid, and they deserve to be acknowledged. Many seniors suffer in silence, afraid to admit what they are experiencing because they fear the worst. But isolation and silence are the enemies of good health. Talking to your doctor, confiding in a trusted family member, or joining a support group can make an enormous difference in how you cope with these challenges. There are wonderful organizations dedicated to supporting people with cognitive concerns and their families, and reaching out for help is a sign of strength, not weakness. For those of you who are caring for a loved one with memory problems, I want to speak directly to you for a moment. Caregiving is one of the most challenging and emotionally complex experiences a person can go through. Watching someone you love struggle with their memory can be heartbreaking, and the daily demands of caregiving can leave you exhausted and depleted. Please remember to take care of yourself as well. Caregiver burnout is real, and you cannot pour from an empty cup. Seek out respite care, lean on family and friends for help, and do not hesitate to access professional support when you need it. Your well-being matters, and taking care of yourself is not selfish. It is essential. I also want to touch on something that many people ask me about, and that is the role of supplements and so-called brain-boosting products. The market is flooded with pills, powders, and programs that claim to prevent or reverse cognitive decline, and I understand the appeal. When you are worried about your memory, you want to do everything you can to protect it. But I want to be honest with you. Most of these products have little to no scientific evidence to support their claims. Some of them are essentially expensive placebos, and a few could even be harmful, especially if they interact with medications you are already taking. The strategies I mentioned earlier, exercise, social engagement, cognitive stimulation, a healthy diet, quality sleep, and cardiovascular risk management, have far more evidence behind them than any supplement on the market. If you are considering a supplement, please talk to your doctor first. Some supplements, like vitamin D and vitamin B12, may be appropriate if you have a documented deficiency, but taking random supplements in the hope of boosting your brain is not a sound strategy. The choices you make every day, how you move, how you eat, how you sleep, how you connect with others, how you challenge your mind, these choices matter. They make a real, measurable difference in your brain health. It is never too late to start taking better care of your brain, and every positive step you take is a step toward preserving the memories, abilities, and independence that matter most to you. Thank you so much for watching today. If this video has given you valuable information, please subscribe to this channel and turn on notifications so you never miss a new video. Share this with someone you care about, because the more people who know these warning signs, the more people can get the early help they need. I am Dr. Charles Anderson, and I am here to help you navigate the health challenges of aging with knowledge, confidence, and hope. Take care of yourself, take care of your brain, and I will see you in the next video.